golf? You still play golf, right?
I haven't played in many years.
Register first, register first.
Okay, I'll just open and then I'll pass the mic to you.
Give me 1 more minute.
I mean.
Yeah. Good.
Once you're ready, I'll pass this mic to you so you can. This mic can.
So many.
Hi everyone, thank you for coming down to today's event. It's a small crowd today, but do feel free to pipe in. There's a mic in the middle for you guys to pipe into the discussion if you have any questions or anything. Let's have an engaging session today. I'm Zing from SGInnovate. At SGInnovate, we believe Singapore has the capabilities and resources to tackle hard problems from around the world, and part of our efforts includes knowledge sharing sessions like the one you're here for today. So without further ado, I'll hand over the mic to Jack so he can introduce the panel. Jack, please.
Thank you. I think today we are running like a workshop like that. You know, we have a small group, so I encourage more interaction, discussion like that. Actually, we also want to take this chance to introduce myself, my association, and also the objective of this workshop today. And in terms of the association, you can see SGInnovate, you know, I bet you just got introduction. ARPA is Asia Regulatory Professional Association. We have more than 3,600 members, about regulatory professionals over Asia Pacific, and we do a lot of educations and publication like that to enhance the professionalism of regulatory people in Asia. So we teach in university. In Singapore, will be NTU, Hong Kong University, Japan Tohoku University, etc. If I know there's a lot of experts here. Let me know. I'm happy to speak. The stable, right? Okay, good. So we also have publication about the registration regulatory book like that. You can buy from Amazon. So this is what we do as an association, sharing knowledge and also doing education like that. Our website, I haven't prepared any PowerPoint like that today, but our website is called, the address is www.asiaregulatory.com. So very easy to remember, asiaregulatory.com. And inside there, you will see our activities. We got tons of online training, which is free. We just finished another regulatory webinar yesterday, and then we post it there for free like that. So we can our training. And then we also have a database of registration requirement in Asia. You can just go there, enter the country name, then the registration requirement of that country will email to you within few minutes, free of charge. And the requirement will talk about what document, how long it takes, how much you charge, etc. like that. So that is something association we are doing. Thank you. Our association more focused on the healthcare. So at the moment, in terms of we have a device, I should highlight that maybe. Yeah, not like it. Okay. It's more medical device, and but yeah, it seems okay. You do really like singing that position, and I found the way. Maybe that's the way. I want to, more healthcare at the moment because regulatory very broad, finance, IT, also regulatory. Our association more focused on the healthcare at the moment. Thank you for the questions. Good, we got the questions so soon. And so that's the ARPA. And myself, my name is Jack. I full-time working in a multinational company called Elegant. Maybe you don't know about this company, but maybe you know our company product called Botox. You know, it is the product invented by our company. So if anyone want to know about Botox, feel free to contact me like that. No fee sample, but I can explain how it works like that at least. Please take a seat. Okay. So I'm full-time working as a regulatory. Actually, I work in many companies before, Johnson & Johnson, Bausch & Lomb, certification body like BSI, GSK, etc. So I hope my wide spectrum of regulatory knowledge can also contribute to the sharing today like that. Okay, so that's myself and also the association. Objective today, why you come here? I think in MedTech sector, you need to have a lot of partners to make things happen or to be successful. Same, even to my multinational company, no matter I'm in Johnson & Johnson, in Elegant, a huge company, they still cannot do everything themselves. They need to outsource to many experts. So today we will talk about, what sorts of external so-called service available, how to select them, and why you need them maybe, because today we even got a call center. You may think, no need, I've got a telephone in the office. Somebody can make a call, then no need to have a call center. Later on you know, having a call center, the infrastructure behind, the design behind, you don't have. And this is important to your business. So it's good to learn something like this. To me, also very eye-opening. Nowadays, call center is not a lot of people sitting in one room making phone call. Later on, you will learn something. I find it amazing. Okay, so no more, your partner can help you. And at the middle of it, I will use some case study. Let's say a product recall, etc. How all these different experts can work together to help you like that. And then I think after that we have a Q&A. I already received some interesting questions from different audience, like how to explain different market, some liability issue about government thing. I got some good input from our lawyer friends already. So maybe we can share more later. So that will be the flow or the objective of today sharing. Okay. Good. So please remember, today very interactive. My style when I'm teaching in university, I ask student questions. So please be prepared. You don't have time for Facebook, all that kinds of thing. People will ask you questions, and then you refer the question to other participants like that. That will be our style. Okay. So let me invite our speaker first. And then I would like them to introduce briefly themselves, their background like that. Okay, so maybe I'll start from Kelvin.
Thank you.
You can talk about your hobby, all that kind of stuff.
Hi everyone, my name is Kelvin. So I run a company. For the last 4 years, I run a company called MediqTrans. MediqTrans, our goal is essentially to help accelerate quality healthcare to patients globally. And we do it through our own means, and the primary means that we do it is through providing services in the language translation field. In Singapore, we don't really see too much of the value sometimes for language translations because we all speak in a common language in English. I'll give you an example. One of our clients is a listed company in Australia, a small one. It's quite easy to list in Australia. So, they did an evaluation that if they wanted to grow their business, they had to be in 6 key markets. So they went through the evaluation, and the output basically was that we performed the services for them, without which they would not be able to easily penetrate into the market. So that's basically what we do on a daily basis. The other thing that we're pretty unique about it is that we are quite serious about how we perform. I'm not a very serious guy, but the work that we do is very serious. So it's very critical to be accurate in our business because there's so much liability. So in the translation world, you have translation services for any marketing, marketing posts, e-commerce, but you talk about liabilities, you're talking about regulated industries, so that's basically things like legal industries, healthcare industries. So healthcare is very special for us. Today we are we're the only Asian headquartered translation company that is certified 13485, and there are only about 3 boutique healthcare specific translation service providers in the world. 2 of them are in the States, and we are the 3rd one. So there's only 3 of us that are 13485 certified. We voluntarily went for that because we just felt a bit more assured when somebody comes to, oh yes, Iju was actually the consultant that helped us to achieve our certification, so thank you very much for that. Yeah, I think we're very proud of that certification. So I think just to cap it off, because I'm taking a bit too much time, right? We've got other partners to introduce as well. So the last thing is that today I think we wanted to cover a bit briefly on the topic of product recalls. So product recalls are something that's very dramatic and can be a bit of a mess. That kind of sums up the work that we do from the translation's point of view as well. We need to make a lot of order through many small tasks. So product recall, to make it very structured and successful, it's important to actually build an ecosystem of the right partners. So that's where we are today. So thank you very much. Jack, thank you.
Yeah, please sit there. And, translation company, I think on and off you may need that kinds of service like that. When I work in different multinational companies like J&J, Elegant now, we also enjoy service from Kelvin company. But the thing is, particularly when our document, if one day you are doing regulatory, your document is go to government, and your translation every little bit distort from the meaning, the government will ask you many questions because they don't really understand what you mean. Then that delay your approval, could be months of delay. So that's why you need to find a good translation company. If not, you will delay your product launch. Could be possible by months for that reason. Then it's not a good business decision like that. That's why translation is not something you can easily just randomly do it. Even by nowadays, maybe Google can do it. No, but that's not the level regulator looking for. Okay. So and then I want to introduce our another partner, Kelvin, from I would call it call center or telemarketing.
Thank you. Good afternoon. My name is Kelvin. So basically, we are in the call center business. What we have done over the last 10 years or so is that we have actually, we are the partners, outsourced partners for the major banks in Singapore. And in how we actually trying to expand our business, the last 3 years, we built up our own infrastructure for IT and also our compliance. And that allow us to actually grow into non-banks customers. So now how we do that is basically, I will call it new generation call centers. Now the banks are still very traditional in the sense that you have to have the agents all working within the call centers, the data are residing in the call centers, and the endpoint, meaning the agents using the computers, all those must be within the call centers. However, with new generation call centers, the agents can work anywhere. So meaning, how we're going to support ARPA here is, for example, like you have agents that is in 5 countries speaking 5 different languages, and the person, the client, you do a recall service, you can be in Singapore, you can track all this, and all your data are all in Singapore. That's how we are able to help this process of recall services. Yeah. So for us, a lot of people may not understand really what we really do. Now, if you do a recall service, okay, basically is what we do is we man your hotline. Now, your hotline, for example, if you do a recall service, if your products are faulty, or there's some people are being sick from using the product, if people start calling your hotline and nobody answer, they will panic. So our job is to ensure that when people call in, there's somebody to respond to the calls. Now, because we work with the banks, so what we do is, your customer data are secured, because what we do is we encrypt all the data. So basically, when we receive your customers, the request, whether it's a complaint or they want to change or whatever, basically we will put them in a form, and then we encrypt and then send to the companies to do follow up. Now, the other thing that we do is actually, because our new generation call centers, we are able to react very fast. Meaning, in this case, we have actually committed to ARPA. In the event of a recall, we are able to be activated within 2 hours. Now, not many call centers can do that. Yeah. So, of course, I think the last point I wanted to make is that because of the new generation call center service that we provide, we are extremely competitive. So, a lot of clients right now, they just need to let us know what is the requirement, and we are able to actually find a way to meet their budget and also their requirements. Thanks.
Thank you, Evan. And please have a seat. And I want to mention a little bit. Sometimes some things you need to know it earlier. You cannot know it on time. Like when you do a product recall, normally my recall experience is I know it in the morning, and then afternoon, the recall will kick off. Your company recall information, for example, will be on the 7 o'clock news. So morning you know about it, 7 p.m. TV news. You have about 5-6 hours. All the different partners today we try to gather is, it seems you need to know it earlier. You cannot just start finding a call center and then have a tender system and then pick one, and then, okay, when we got a hotline, they will say 2 weeks later. Then, oh my God, then who the people then can call your mobile phone maybe. Then, no, the customer call my mobile phone, no, you don't work like that. So, that could be one example that when you really face a disaster or crisis, today we are using recall as an example, but in a company, you have many events or situations, you will need a lot of the different service like that. So we're just using recall as an example today, so they can feel the urgency, how tough is it, what should be the requirement, like that. So without further ado, let me introduce another friend you should know earlier. Maybe Amos first. Amos is working in legal. I think you know why we need to know him earlier, because legal issue could be very tough. Amos, please.
Firstly, I'd like to thank Jack and Kelvin for inviting me to this panel, because I'm going to stand on the stage because I'm also clearly not very tall. Because I think that this is a great opportunity for me to learn, and it's for you guys to learn about this rather new possibility of issues in Singapore. Someone asked me earlier at the open networking, or earlier before the session started, so do I have a lot of experience in this? I'm a litigation lawyer of about 8 years. And I'm happy to say that I don't have a lot of experience in the MedTech industry, which means that we haven't had a lot of cases where we've had to sue people or defend people who are being sued in this. That's a good thing. But the fact of the matter is that's not a given. There may be issues, right? The Singaporeans may well know the Slim 10 and the Andrea de Cruz case. So the question is then, what do you do? Do you want to wait till something bad happens and then you react and then you ask around for a litigation lawyer and you figure out what needs to happen at that kind of time and then you fumble because there are a lot of things that you have to do when there is a product recall, right? So when I had to think about today's workshop, as Jack calls it now, and what services or what I would want to tell all of us is that, litigation is not just how you react when there's an issue, when something bad happens. The ideal for me as a litigator, I know it sounds very silly that I don't want business, but the ideal is that as a partner, as a friend, I help you such that you prevent these things. So I help you train your staff, I help you put things in place such that you don't end up admitting to liability when you didn't want to. You don't end up creating a hole that is bigger than it has to be. So I think that's what I'm very excited to explore with you guys in case there are issues that happen. And I'm very thankful again to Jack for this opportunity. Thank you, Jack.
And I want to also add something is because I talked to different participants today, some of them thinking business development. I want to go to more market, expanding to more countries. As a company owner or leader or manager, I think you always need to have some sort of risk management mentality. You expand your business. Seldomly in the company, people will think, well, what will happen when crisis happen? One could be recall, one could be some product event, adverse event, somebody want to sue you, and then, all sorts of problems. That you only want to think about it when it happens, right? But, be a better management, you prepare for it. When it comes, you're so equipped in terms of maybe network, so equipped in terms of knowledge, maybe because of some training, then you can handle it comfortably, maybe in a constructively, so that you don't have a further damage to the company like that. So that's why today you will see a lot of interesting mix because although expanding to business regulatory enough, but actually we have many interesting partners can help your business. Not only expansion but also risk management part of that as well. Without further ado, my last speaker, guest speaker is Yuen from, I would say, the PR company. This, to me, is one of the most difficult things to master. Nowadays, when you have a problem, media will ask you a question. Hey, your product, makes somebody hurt. Do you feel sorry about this? This is a tough question to answer suddenly in front of media. Oh, I'm not sure my product maybe don't kill you. Then the next year, next day, the newspaper say this guy is so cold-blooded, don't care about people, don't even want to say sorry, like that, right? And then, but you say sorry, oh, the company already commit, they feel the problem is them, you should go after them, they are bad company. You just don't know what to say in the future when you deal with media. To me, media training, I've done it before. Is very important skill, and I make use of that skill to talk to my wife as well. So that's maybe later on that is very helpful. So you can pass it to you.
Yes, hi everyone. Sorry, thanks Jack for inviting us here. So I'm Yuen from Prosper Communications. So at Prosper Communications, who are we first? So actually we are a PR agency of almost 2 years. Currently we have a staff team of about, I think, around 20 people. And over the past 2 years, we've serviced over 300 clients across a whole wide range of PR activities. So the main topic here is crisis communications, but besides that, we also deal with other PR activities, such as like media outreach and engagement, You want to do your stakeholder engagement, such as your consumers, campaign activation, social media management. These are all things that we are doing. So in the case of a product recall, what we actually do usually as a PR agency, like Jack mentioned, right? So you want to know what you are going to say in times of a product recall. In Singapore, the situation is that, now due to the media, the social media, and so once a product is recalled, right, and once there is backlash, something happens because there's a defect in your product, people will start talking very quickly. The news will spread. People start talking about it, and you want to be well prepared for this and to come out early so they can control this conversation. You control the message that goes out, prevent people from unnecessary speculation, and prevent the media from making the most out of it. So usually what we do for our clients is that we will work with them. We prepare a crisis comms SOP, really have an SOP in place, have a holding statement in place. So you actually prepare for the crisis before it even happens. Yeah, so it's not, we are not in a position to help you prevent the crisis, but we are in a position to help you be well prepared should the crisis happen, and you know exactly what you're going to do. What's the SOP? Who's the spokesperson that's supposed to come out, and what is the response that you're supposed to give to each of the stakeholders, the media, the consumers, and all that. So later we will explore more about how we can help in such a situation. Yeah, thank you.
Thank you, Yo. Okay, so let's kick off our core topics, like how different partners can work together. And I'm thinking to use recall as example. But if you have other crises or issue, please feel free to bring up, because eventually I think a mix of the team like that can also help your issues. Yes?
Can I ask questions?
No. The Q&A part will start later. Okay. Thank you. Wow, this is good. I park your question like that. Okay, so because I want to see you, let you have example, see how the whole team work together. So I use one example first, then I go to the floor for more specific questions, then we can discuss like that. Is okay? Sorry.
Because you said product recall being one example, another maybe in diagnosis.
What?
I know you're into medical devices, but maybe in diagnosis as well, there's enough potential.
You mean the in vitro diagnostic product?
It could be because of a translation error or
Of course.
or somehow another.
Sure.
Then the PR issue and stuff. So diagnosis.
Yeah. To me, this product recall, the knowledge or the experience we may share actually apply not only to medical device. If we recall a pharmaceutical product, other product, I think it's a similar, nature of the problem you can deal with. Okay. So, but let's. Sorry, come again.
Because when you talk about product recall, it tends to be more like a consumer product where it affects more than one person. Whereas you talk about diagnosis, could be one person only, or could be a few, 2 or 3, and it's quite isolated. So, but the event could be a lot bigger in that sense because it's a reputational loss. So maybe it'd be interesting to hear as well.
Sure. Good. We can add more that specific topic later. Good. Thank you for the questions. Okay, so now you learn the way. You don't ask, can I ask question? You just ask, No. Then it's difficult to stop, So. I start to lose control of the panel.
That's what you did.
Okay, lady.
Okay, so I have actually a couple of questions for the panels. Thanks for putting together all these very entrepreneurial individuals. And first question is really the translation portion. So translation company done a lot for MNC like yourself. MNC stand for multinational companies, like Elegant is one of them. So how do you go about to validate the translation accuracy? Because you don't just simply outsource to a translation company. So that is one question. Yes. Yeah, you're right. Maybe I'll just go around and then back to you. So second question is actually going around and back to you too. So this gentleman talked about product recall. You can help for calling call center. So a lot of time in MNC, the product recalls are done through the regulatory department where MDR, you need to get it from the healthcare authority, whether it's US FDA or Singapore HSA. They announce throughout the public that under this UDI. So my question for you is, maybe to you, Jack, is that UDI tracking, a lot of time for a small MedTech company, they will go through distributor. Wouldn't that be better if you were to go through distributor, to call a distributor instead of set up a call center for so many hotlines?
Okay, I can.
So if you can prioritize like who should be the first group of people to target.
Okay.
Because distributors are the people that distribute our products throughout the users. They should have a way to track the UDI. So if you can comment about the UDI situation right now in the Singapore MedTech or Asia MedTech with the perspective, that would be really useful. Good. I guess the lawyer, I'm sorry, I don't have any questions for you. I try to avoid people like you actually, and the media too.
Congratulations, I don't have a question. but the thing is, I think we have a good warm up today. Already question coming up, and that means the participant is thinking, because I also want you thinking. I don't want to teach you when you have a recall, you do this, that. You don't have a feeling. So let's create an example. Let's face a situation is now is a Saturday, 12 p.m. lunchtime. That's the real case. That's exactly my case in Bao Shenlong recall. Saturday, 12 p.m. You got a call from government. In that case, or HSA, say, hey, see about your product. Have some issue, I got some report from doctor, wherever. I nice to you, I tell you now, there's 7 o'clock news. I will press release, say your product, we will announce our government want you to recall. Okay, so from 12 to 6 o'clock, that you have about 6 hours, I will ignore all the business topics. Sometimes you need to talk to your boss, what's the impact to the business, all that kind of thing is a company-specific problem that I won't deal with. But how to handle the recall in these 6 hours will be the journey I want the whole team to go through. And let's have a fun about that, because it don't happen to you, right? Then you have a fun, you can enjoy. 6 hours is like a movie, how these 6 hours, ups and downs happen to you. And, I asked you a question, right? So normally I study in UK, I enjoy the tradition of lady first. Okay, so I ask lady first like that. Maybe I ask, maybe here, you ask a question. If you don't mind, I ask you a question first. If you have a product recall, now you've just received that call. To handle the product recall, what will be your first step? There are many things you can do. Let's call lawyer. Hey, let's set up a hotline. Let's talk to the boss, let the boss decide. What will be the first thing in your mind? Because maybe, okay, let's check the SOP maybe. Company have a SOP, let's have a look maybe. So what will your gut feeling look like? Have you done a product recall before? Okay, I better give you a mic.
I've not done a product recall before, but managed an InfoSec breach. So I think it kind of goes hand in hand, like a crisis when it happens. I think my first hunch would be that I reach out to our internal InfoSec or like internal legal team to say what is it to be done and how to even approach this.
Great. So there's a very common approach that you form a recall team. And normally the country GM responsible will randomly, not randomly, but select a team member. You. Okay, let's have a team meeting. and nobody have a good mood on Saturday, have a, handling a product, and nobody full-time doing this job, I believe. No people call recall manager in their job. No such job as well. So, this is like a funeral. Nobody responsible. And suddenly, everybody need to handle it for a short time, and then after that, go home, and at the end, by the way, nobody will thank you. Hey, such a good recall you done. I will promote you. No, nobody thank you. It's like funeral. Nobody will thank you. Oh, that's a great funeral, like that. So it's a job that's difficult to have a satisfaction, and like that maybe. But now you form a core team, right? And then you realize that, in my experience, that you normally refer to the company SOP. And the company SOP, in most of the company, tell you nothing. Let me tell you why. For example, the government, in the call, they will tell you, okay, and the 6 o'clock news, you need to give a hotline. Because your product impact bunch of people need to call your company so that they know what to do. They don't call to the government, right? Don't call me, call you, okay? So you give a hotline in the TV. Now I want to come to Kelvin, to get his expertise. Because I tell you my challenge at that time. When I want to form a hotline, I just at that time thinking about, my internal team can do it. Somebody reception, take up all the call. But we realized our product at that time is a contact lens solution. There's 200,000 people using it. 200,000 people calling us, reception. I think many people will not get full. And then if they do not get full, like Kelvin mentioned, who they will call? They call HSA. My God, this hotline don't use. What's going on? What can I do? Then the HSA will call us. My God, what's wrong with your hotline? You need to have more people, etc. So eventually, you think that your reception don't work. Then who else can you call? If you try to save some money, like that. This time you pass a question to another person. A lady here? Okay, good.
Oh, okay.
Okay, maybe gentleman behind his looks so smart. What's your name again?
My name is Amit.
Amit, nice to meet you.
Again, you did not ask me earlier. First time.
Okay, so if you don't outsource, who can we call in your company? 200,000 people. Of course, they won't call it at the same time.
So you will need to probably check what are the batches which have been informed to you by the government which are being recalled. Yep. And you will probably check with the production and the logistics where these products have been dispatched.
That you can deal with the Q&A. But the thing is, now my quick question is, who in your company can handle all these customer calling in? Like, what's going on? What's going on? Somebody to take care of that call.
I think you'll probably have a customer support department, or
you'll be good to have a call center in your company, right? But
you want me to lead to him, is it?
But normally companies don't have a call center. So
yeah, so I'll call you and you will call him.
No.
That's what I say.
I want you to go through the thinking, because now you should outsource. Then it sounds so maybe why I can handle it. At that time, I call reception. No, my another friend working in Boston Scientific, she's a regulatory. She take up the call to give her mobile phone away, and then you know what I mean. People will call you at night. Because people after work, they start making this call to check, hey, my mom using it, what should we do? All that kinds of thing. So night call, 24 hours possible. 200,000, tough. And my friend, she talked to another person over the phone half an hour. After that, she realized that person is a lawyer. My lawyer friend will be drama. My God, you talk to a lawyer without any preparation, right? And then, do you remember what you told the other side? Oh, maybe I say my company do this and do that, and I doesn't know what it will mean to my company. You know, somebody may record it and become a case. Your company representative say this and that. You know, then, you know, later on I will pass to Amos what will happen to that person. So, you know, that means some training behind. That means somebody can handle 24-hour call. Not one person, but a team. And that you should be somebody answering, saying something, not machine say, press 1, press 2, and then at the end leave your message. Nobody talk to me, they don't like that. So that essentially means outsource. That's why in our company case, we also outsource. And Amos, maybe you talk about your infrastructure. How can you make sure, you know, there's a way that people will answer? And if an angry customer call, you know, normally people don't talk nicely. So, you know, what any particular, you know, uniqueness about your call center thing you can briefly share? Kelvin, please. Thank you.
Okay, I will first of all is touch on if, for example, you have a recall. Now, typically, if the company is not thinking about a specialized team like from ARPA, you know, you basically what you do is the first person they will get is the secretary, okay, secretary or some junior staff to man the hotline. Now, the problem here that we will feel. First is does the secretary or your junior staff, you know, or intern or those that just joined the company, you know, from polytechnics or university, do they know what to tell the customers? Most likely, they will not know, and there's a tendency for people who works within the company to tell a lot more than what they're supposed to tell. Secondly, if after you've spoken and the customer come back and say, maybe an hour later or so, and say that, you know, I asked you, you told me this, but it was the wrong information you gave to me. Now, then do you have a mechanism to actually, evidence or mechanism to actually prove what you have actually told the customers? Third, if there's a lot of people calling in, basically it's everybody cannot get through the line. So you have a lot more angry customers who's not able to get through. They will complain to the press or complain to the regulators and saying that, you know, I've been calling 4 hours and I couldn't get through, and you know, my mom is sick, you know, right now I don't know what to do this. Now, if you actually put on outsource, for example, to us, first of all is that our agents will have a call script. Every call that comes in, they will follow exactly the call scripts. They will not say more, they will not say less. Their job is not to explain to customers what is this recall about, unless in the call script you specify. If they call in, this is what you tell the customers. So they will follow the exact call scripts that you wanted them to do. So whether is it 1 person or 1,000 person, they're going to tell exactly the same. So your management will be comfortable because you're giving the right kind of information. So like just now the lady was saying, why don't you get the distributor to answer all these questions? Yeah. The question is, the distributor... No, wait. I think when crisis happens, sometimes the distributor is involved in distributing some contact lenses. It's true, because they are also a customer. So some customer by directly going to the distributor instead of going to the manufacturer, which is a more prevalent cases. So in that way, my question for you gentlemen is that you want to train your core people to be able to have a script in so consistently with compliance to the regulation and the SOP of the company when you are talking to the customer. So there is a lot of things for a regulatory department to do in order to train your people
or train one or 10 of your trainers to train so many of them. So my suggestion is that maybe a phone line can be dedicated to explaining that at this time, at this date, there's a recall of so-and-so contact lenses solutions or something due to what, there's no major something, so that you kind of to calm down all your customer instead of really need to talk to every one of them.
Yeah. We don't do that. We don't do that. You think about it. If a consumer comes, give you a call, what they want, the very first thing is that I call somebody, pick up the line. Second is they have questions, whatever, or they have queries. They want you to be able to get back to them. Now, so from a call center perspective, what our agent do is, basically is that they will pick up the phone. For example, like the SLA can be 3 rings you pick up.
Yeah.
Okay. However, if there's a missed call, they will always call back. But if your secretary, if your phone system doesn't have the ability to track missed call, you're in trouble. Okay, that's the first thing. But the agent do not need to know your product. They only need to follow the call script. So what they do is, for example, somebody will ask, when can I get my money back? When can you send somebody to come down to do this, do that? Basically, the agent will basically take down all this information in a form. They will key in all this information and then pass to the company. For example, it could be the engineers, it could be the...
Actually, quality department is what I'm thinking. So the regulatory are working with quality department. But my question really is, instead of driving Jack and his colleagues crazy on such a short time, you could have helped them as well, because the recalling SOP of the company is important just as much as the recalling process that defined by a regulator from any in-country of their. That's why I want to ask Jack, how you go about to ensure that all this process is so smooth and is abiding with compliance and making your customer very comfortable of the situation, as well as not to drive everybody crazy.
I want to share as well, because personally I deal with many recall like that. I fully agree with Kelvin. At that time, many customer call. They just need somebody really to pick up the calls. I want to say to somebody. And then if someone able to pick up my call, I'm able to leave my information, somebody will follow for me, good enough. Because you won't have all the experts available, answer all the 200,000 people question like immediately. But that person answering questions, talking to me, taking my contact detail, follow up my question, good enough. If I miss a call, you will call me back, even more happier. I don't need to call back. And behind the infrastructure, that's why today I bring all my partner here, how they help me, and then why I pick them, like that. So, because, in a distributor, they don't have a call center. If they miss a call, they won't call back. And they won't work in a shift to take 24 hours. So they are different purpose. They have more to call to make order rather than handling a product recall like that. So that's the interesting nature about this call center. Yes, please.
I mean, just to answer the question briefly, even if you're a customer as a distributor, to a certain extent that is true. But what will happen if there's really a product recall? Ultimately, from the government's perspective, correct me if I'm wrong, it's still the manufacturer's responsibility. So the manufacturer is actually expected to notify the distributor that this product recall for this product with these badges, etc., whatever, is to be recalled and no further sales, so on and so forth. So after that, they are also supposed to tell them, use this number, for example, or go through this SOP, redirect any calls you get to this particular process, which probably will be this call center meant by Kelvin. So that's probably the process that you're actually talking about.
I have no problem with that. I'm just saying that from the perspective of the quality department, the feedback that you collect is for them to do CAPA. They have to follow up to correct all these actions of their products that is going to quality in question mark.
That's why
so
the recording
for so many calls can come from so many different directions. How will quality people to really sort it out and come out with a report saying that these are my customer complaints and what are the actions that I have to take care of them? So I'm just trying to say that what is this process in place? So like what you say, there is a compliance SOP that say that you definitely have to have a hotline. for the customer when you product recall. Product recall have a lot of reasons, so I'm just saying that's the critical reason. So in the perspective of quality department, I just think it's just as important to involve.
Yeah.
What? Thank you.
Maybe I just want to add here. You're right. Okay. Internally, there should be some kind of a SOP. In terms of whether is it your quality department, etc., or your product department, whatever, how to get back to customers. Now that's where we come in. When the customer call, we put all this onto what we call the feedback form. This form, for example, there's 1,000 form that you send to the quality department, and then what they do is maybe of this 1,800 that you can actually reply through email and inform them. The emails are all there. Basically, you have a standard reply, you email to them, they are happy. Maybe 200, you have to call them back, and you may get another department to call back all these customers, 200 of them, and say, okay, this is, you call in when, and then this is what we do. That's actually the thing that we do. Now, there's actually two other things that you have to consider when you want to do a so-called hotline. Okay, one is basically if there's a dispute, your let's say, secretary told them too much information or too little information, there's a dispute. Typically, a lot of companies do not have voice loggers, but in our case, we do have. So when there's a dispute, what we do is we pull out the voice logger, and you will know exactly what your secretary told and what the customer asked. So that at times, right, you help to calm the customer down. Now, the other thing is, when you want to do a recall, you have to estimate how many calls, how many incoming calls you're expecting. Because there's only so much one agent can handle. So, for example, if you have, say, like Jack said, you have 200,000 customers. Now, then the question will be, will 200,000 customers call in at the same time? Or you only expecting maybe 20 a day? Or you're expecting 300 a day? Now, that's where we are able to, what we call scale up for you. You're not sure, you start with one. One can maybe handle between 30 to 50 calls a day. But suddenly you realize after the first day, you have something like 300 to 500 calling in. One agent is not enough because there are a lot of missed calls. That's when we quickly scale up. For example, we quickly put another 5 or 10. And basically, we put 5 or 10. That's when your customers, when they call in, they'll get somebody to answer their calls.
Right. Thank you. And for the interest time, we just hosting the hotline. The hotline already tough, right? Because nobody really have it, and there's a specific requirement you need to deal with. And the hotline actually, switch very naturally to the legal side. I want to talk to Amos a little bit. Is about, the liability. If the startup says something wrong, I think everybody agree is still representing the company will take up the liability, right? But one liability I want to get your opinion is, in terms of this liability thing, I want you to give us some comment about how do you see it. And one of the audience here or participant here also mentioned, sometimes not necessarily recall, it could be recently like data leakage. Like an AIDS patient data leakage. It's a crisis. Then who responsible? Is it government you responsible, or no, you company responsible? Like that, how do we define it? So, Amos, I want to get your opinion on that legal aspect.
It's like Law 101. In the sense that I will try my best in a short amount of time to share some thoughts. I think when Jack asked me, the first thought that he came to my mind, or that he mentioned, was contractually, who can the consumer sue, right? Obviously, the person who sold them that product, right? But as with the Andrea de Cruz case, essentially everyone who brought in the product or was involved in the process of bringing the product, from the importer to the wholesaler to the distributor, they were all, in that case, found liable for negligence, right? Because they all owe a duty of care. Basically, if I bring in a product, right, then I owe a duty of care to anyone who may take this product, because I am saying that this product is safe for you to take. Now, then brings in the tough question of the government, right? And I record it. But essentially, in the sense that, well, the data leak aside, in, let's say, such a case, and they have gotten HSA approval or something like that, there is a possibility, depending on the steps that were taken to get HSA approval, that in some part the HSA may be liable as well, because they have approved that product. Now, of course, I'm not recommending you to go ahead and sue the HSA, but all I'm saying is that in such a case, it's not so clear-cut that the one particular person is liable. It could be multiple parties. And then we go on to the short slight diversion about what happens if the person that you didn't educate or that the call center said something wrong and admitted. Well, very briefly, that goes to evidence. Just because someone may have admitted on behalf of a company that they were at fault, they said sorry, they said, oh, so sorry, we screwed up, we'll pay you, that kind of thing. That doesn't equate to liability, right? However, if it was a director or it was a manager, a general manager who said that, now that's very clear. That would be a lot stronger evidence that the company has assumed liability. But if it were a temp staff, if it were intern, I think it would be easier for me to argue away. And the last question, data breach. Essentially, I think Singaporeans would be aware that generally, if the government, they called the COI and they got a group of people to determine where were the breaches and what could have been done better, essentially it's the government accepting fault, right? Basically, someone screwed up. But the question here is, as an individual, if my data has been breached and it's been leaked, can I sue the government? Arguably, yes. What could I get? I don't know. What damage, what loss have I suffered from my data being breached? Have I lost my job? Have I lost my love? What have I lost? What can I sue the government for? So unless you're saying that your love or your job is worth millions, it's really not worth it to sue the government. Thank you, Jack.
Thank you. And that's why, you need to, like Kelvin said, the recording. If not, there are not many things to argue. You said that, you don't say that, that kinds of thing. And to me, this liability, the concept pretty, now I get pretty easy, the other is a contract, or, by nature, you do have that responsibility. And if you want to sue somebody, I found this concept very helpful, because when I deal with milk powder company, ARPA, so many people want to sue us because they found an insect in the milk powder. They will say, hey, you really killed my baby, there's an insect I can find in your milk powder. Then I need to test that insect. How come this insect is inside our milk powder? And then we test, it's an amazing story. We test that insect is Australia fly. This fly can only found in Australia. So, not in Hong Kong. So we get away from the case. No, this is not our, the fly from us. Maybe fly from you, etc. So, a lot of interesting thing about this liability thing. But the most important legal aspect I learned at that time, like Amos mentioned, is no matter you find an insect in the milk powder, what's your suffer or loss? If you have proof no loss, no suffer, then you go to court. The court will just give you a nominal compensation. Okay, then you go $100 back, like that. So then there's no case actually. So that's why sometimes as a company you become, you ask the right question. Okay, then what's the loss? What's the situation? Is it somebody go to hospital? Or no, you just scared, you open, wow, my God, you close it back, and then it seems nobody hurt. Then maybe it's different liability. Yes, please.
In this kind of instance where you're talking about the insect, the onus of proving that the insect was there in the box comes onto the consumer, or the onus of proving that it was not there comes onto the company. I would like to get some enlightenment.
Of course, as a company, we will try to prove it. But if you want to sue me, you need to prove it. So it depends on who the intention, like that. Me as a company, I know about this case. We will try our best to do some investigation because at the end of the day, it's not only for this case. We also want to know our manufacturing process something wrong. How come we have a fly or insect in our milk powder? Then maybe our whole production line no good. But at the end, we realize our production line is in this country, and this file never in that country. Then, you know, then my production, that file is not from that country. Then maybe it's from a consumer home, you know, because the file come from that country only. So, you know, luckily you have a chance to prove that case, then you believe, okay, my production line, okay, etc. So as a company, sometimes we want to know it. But if you face a company, they don't care. Then you want to test and then sue the company. My God, this file, I can have some justification from you, not from me, etc. Like that. And then you come to another situation, which is media. Because when you come to recall case, somebody die, somebody suffer, you know, the media will go after you. Like I mentioned, you say sorry, no good. You don't say sorry, people say you cold blood. So, you know, like wife asking you, you buy this or don't buy? So now please help us. Any particular PR so-called tips you want to share, you know, when we deal with media thing, you know, particularly when do you feel sorry your product kill somebody, you know? I found this question tough. You can hold it, you can hold it. Later.
Oh, maybe later.
Answer question first,
Okay, sure. So I think in the product recall, right, how we will deal with the media. So I think firstly, let's define media. I think a lot of us, when we talk about media, we think about like just the newspapers, you know, online websites, online news websites. But in this case, we want to take care of social media as well. So this is one portion that a lot of us might neglect. So because consumers are a very huge part of the stakeholders, and now with social media, you know, Facebook, and all of us know how Singaporeans are like on Facebook. So if you let the conversation go haywire, it can be very dangerous. So in every case for product recall, usually what we recommend is that you need a crisis comms SOP, as I mentioned just now. So usually we will recommend for the clients that you don't prepare for crisis comms only when it happens. You don't have enough time to work on it. Prepare for it way before it happens, so that once it happens, you can immediately take action. So like you mentioned, should you apologize or not? I think we have to see the situation. Definitely, we want to approach the situation. I think one mistake a lot of brands are doing is that when there's a crisis, or sometimes not even a crisis, when there's criticism, a lot of brands just start getting very defensive. You know, they are like, oh no, you're wrong. Some brands even start to argue with the followers on Facebook. So that looks very bad lah. So I think in a crisis situation, we have to understand that we want to put ourselves in the shoes of the consumers. We want to understand that because these are medical products, these are pharma products, they themselves, or maybe some of their loved ones, they may have ingested these products that are potentially hazardous to them. So we have to understand that of course, they are concerned. So usually what we will tell our clients is that we see the situation. If it is a defect with the product, acknowledge it, be honest and responsible about it on Facebook. And of course, we have prepared a holding statement also for the media. If any journalist comes asking, oh, how about any response from a company, that's the statement we will send out to them. So it's a standardized response. We immediately own the situation, control the message, take responsibility, and share about what next steps you will take to remedy the situation. So provide a hotline, like I think earlier we mentioned, provide a hotline that they can call to share their concerns, or otherwise, are you intending to do any refunds or partial refunds? So these are all things that we should be sharing with them.
Good, thank you. And I highly recommend the team here get some media training beforehand, because when the crisis happens, too late. Let's do a study. You only have 5 hours to do the things we just mentioned, the hotline, consult a lawyer. The media, actually at that time, we need to talk to all the newspaper and TV before somebody do a press release themselves. We want to PM the media with some information the company want to say first. So, you know, do you have the network? You know, at that time, in 2 hours, we talk to a teleconference with all the key media, newspaper and TV on the call. Can you do that? If now somebody need to help you to arrange that call, then you told them our company situation, what we think, what is our next step, that kinds of thing is the power of the public relationship can help you. And one thing, the media training, I really want to share because it helped a lot of gentlemen here maybe. I call this answer machine, no, they call it answer machine skill. Have you heard? Maybe different country call different name. This is a very popular news reporter. They organize a media training to us, and they teach us this is an answer machine technique. So you just remember 3 or 4 sentences that your company want to say. Because you say too many things, news reporter will pick up the word and then will say, see, this guy say something, and then, no, I didn't mean that. It's too late to argue. So we only say 4 sentences. The 4 sentences could be, oh, our company care about the case, we are still investigating, and we will try our effort to solve the case ASAP. Maybe this is a few sentences you can say only at the moment, because you never know your investigation, is it your product cause a problem or not. But when you're being interviewed, do you feel sorry? We really care about this case, and we are investigating. How about that patient, the husband is so important, and the whole family suffer now. And then what will you do to this family? We will invest this case and come back to you quickly. And then, they ask whatever different question, you just mix all your answer in a different manner, and then you have to say it with a passion, like that. So like talking to a wife, of course I love you. I will consider to buy this bag or not. And then, so buy or not buy, I will definitely consider because I love you. You never come up with an answer maybe. But that is a mechanism to protect yourself, not being extract funny sentence into the news like that. There are many skills, I think, but one is the answer machine skill could be quite interesting one. And then at that time, when I do a recall, one interesting translation problem happened. I think quite a language problem as well. That when we do this recall in Asia, some material, we call in Hong Kong, Taiwan, China, like that, right? Something you will say that, right? But some company carelessly translate, will recall in the following countries, Hong Kong, China, like that. Then when you do this announcement in China, China's super unhappy. You know why? Because you say, we will recall in the following countries. Who say Taiwan is a country? You already in a recall situation, enough problem already. Now you go into political problem. That this company announced Taiwan is a country, that must be joking. We China never agree with that. So we need to recall product and also recall press release because you accidentally, some translator so nice, add a country for you. Oh, we call in the following, maybe look nice to add a country there rather than market or whatever. So then that create another nightmare. So this translation, you need some professional. You don't ask your Google thing to do it for you sometime. So you never expect, right? We call. You can even deal with political situation. Then you need to find lawyer again, the government, I don't know how to deal. But again, I want to quickly, give you a sense. Suddenly, you see so many friends in your field, how we can work together in a recall basis. Of course, sometimes I may contact Kelvin for my telemarketing service, Amos for my legal service, but recall, is a good example I want to share with you that meet more friends, know them beforehand, get some training, and maybe get ready for your recall. If there's some recall training, some media training, maybe we'll consider to roll it out. And then, that may be something I highly recommend to the team. Business development, good, but protect your business, very important. And to me, this is a guide to protect my, my business somehow. Sorry, I have some questions?
Okay, before you have a recall, obviously there must have been some sort of adverse event, right? I mean, the government cannot just blatantly say this is the manufacturer's problem. At what point, there must have been some sort of investigation already. At what point can the government, initiate and say there's a high likelihood that this is probably the manufacturer's problem?
Right. Thank you. How the government initiate a recall? Okay, this is a few aspects. Scientific aspect. Okay, they see so many people die already. I think easy to say. Even when people die, then scientific way. Another way, I think the team here understand, particularly the public relation, political way, public media pressure. Unfortunately, my company recently have a recall. In a country, there's no people die, no new adverse event. But in other countries, they have new adverse event. But the media in the local, so hot, so many issues. Then the government feel the pressure. My God, so many people talk about it. Even there's no case in that country, you better recall. I think that the team may here understand. I think even you can understand. Sometimes the public media pressure high enough to protect your government job. Feel like you do something. You guys recall, fine. I'm fine with it. So please recall. They don't need to give you a very solid reason, a scientific reason. I want you to do recall, just like that. Creating a reason, not that difficult. So please understand, when you do a recall, again, how to make that decision, also expert here, because media pressure, liability, because you say because somebody want to sue you, because government also think your product have some problem, maybe litigation could happen, etc. Then suddenly really initial recall, then call center come up, other service like translation also come up like that. So that's why when I think more about it in my 20 years of regulatory experience, I found that regulation, I think Amos will agree, regulation is an art, not science. It's subject to interpretation, a lot of negotiation. By the way, the law degree is an art degree, right? It's not BSc, it's a BA, right? That's why it's an art, That's why some lawyer expensive, some lawyer not that expensive. They study the same book. Some so expensive because they have a different skill to interpret the regulation, to negotiate in the court case, etc. So it's an art. So to this decision, also an art like that.
Can I make a comment on this, gentleman? Actually, it's in Singapore. The regulation is GN04, medical device recalls, and under the GN04, there are 3 criteria for recall. So you can go and read, but it's exactly what Jack have mentioned.
That's a scientific way.
Hazardous, as well as not complying to the act of recall, and there's another hold to the manufacturers, wholesaler. So that's all this SOP or the documents that we need to compliance. But I do agree that regulation is an art, because the art that you need to convince the regulator with all the scientific evidence that your product is safe and efficacious when you put into any of the market of Asia. So that is the fundamental belief, but how you approach to describe that your product can meet all these requirements and yet to be safe and efficacious to the market is a great responsibility of the manufacturer. So if you have any problems, you can use, just like a lawyer, you can use a good regulatory consultant like us. We are a regulatory consulting company.
Yeah, we
are
also
from
have a
Agape
regulatory
Life.
consultant in the room as well. Good.
Yeah, like for example, my question is more about like the clinical side and like for example, if a product, yeah, like let's say a medical device.
Yes, clinical side is very prevalent.
Clinical, yeah. Is it a doctor's problem? Is it a user's problem? Is it a device's problem, right? So there must be some investigation beforehand.
Yes.
Or what should happen first? Should the investigation happen first or the recall?
Usually it's the complaints enough to the HSA. So when doctors is prescribing this device into the clinical usage, then anything happen hazardous to death to this patient, this is the healthcare practitioner, which is the doctor's responsibility to also let the HSA team know that there's a few issues, and then they also have to tell it to the manufacturer that is happening to the patients. So actually, when it all comes from the customers, which is the patients, when they are using it, if there's hazardous to their health. So that is one thing that if these cases is complaining enough into the HSA MDR, so they will take a closer look at it before they take action towards the manufacturer and start calling people like Jack and say, hey, what's going on, things like that. So it actually should be a collaboration between the regulator and the manufacturer. Like I say, the regulator purpose is to be making sure that the manufacturer put a product or launch a product into the market, safety is the first thing that they concern to the patient. So whatever they do, they are ensuring patient safety. So we shouldn't see it as it is like they are the police trying to give you a hard time, but rather they are trying to protect the patient health. So it should be a collaboration with the manufacturer.
Okay, I think the registration philosophy we understand now. Good, thank you. I want to open the floor to other questions because these two corners dominate all the questions like that. So any other issues or questions the team want to answer as well? Yes, please.
Okay, so I have one question. You took the example of recall, which is a very, very strong example, but we don't usually expect it, although it is good to deal with it in advance.
Right.
So the same team, how would their insights be about a product launch, which is much more commonly expected, and we have a startup and SME segment here of the audience.
That's a good point. For other situation, how we work together, right? So, you know, when you launch your product in the whole region, etc., translation service, very obvious. Telemarketing is one of your marketing arm.
So do you have, or do you intend to come out with a certain package which includes all these 4 talents into one?
Into one?
Into one package which you can market.
Let's talk about how to launch this service like that. It makes sense, right?
I mean, one-stop shop.
Yeah, it makes
all
sense.
These things.
So.
You won't allow them to speak.
Okay. So now.
I was just joking.
Yeah.
I was just joking.
So, sometimes, you know, we need to, as a consultant, talk concisely. Okay. That could be one thing. And actually, we as an association, maybe neutral enough, we will just launch this arm because we just gather all the partner.
Yeah.
You know, we don't select only one like that. You know, we can gather all the good quality partner that you contact them.
I think that's a good idea.
And nowadays, even in our website, people ask us regulatory questions, and we answer them free of charge, like that.
He has an official job at MNC, so we should be more prevalent in helping you guys.
No. Our association
I will
answer the
help you
questions.
to come together, don't worry.
Yeah, the association answer the question, not me. There's lots of people behind like that. And of course. And when you're looking for knowledge, when you're looking for some business partner, because we have so many members, we are happy to recommend, give chance to our members, some referrals, some business like that. So that will be the way. And that will be my quick answer. Thank you. Thank you for your business idea. You will see very soon we launch this service maybe. Our service maybe. Thank you. Any more questions from the team here? Okay, so let me do one more advertisement. Association. www.ag.com. You will see different expertise that may be able to help you. You will able to get registration document requirement free of charge. You just enter the country name and then they will tell you. If you cannot find anything, your problem to find their website, you can link in me as an association founder. I will try to help you as well. And please feel free to contact our guest speaker today. They offer many different interesting services that will help you like that as well. So thank you a lot for your time. And that's a very interactive workshop like that. Thank you. Thank you.
Finished. Where do you my name from? Where are you from? Interesting. What do you do exactly with this? We also regulatory consultants. You're from? From someone who actually
Thank you again. No, when you're talking, you don't feel like standing. Right?
So I'll get